Worry not on where to advertise your business or your product. Call us on 0114 777 000 or email us on info@faithtodaytv.co.ke.
Every great journey begins with a single step. And at JCK Hospital College of Health Sciences, that step is met with warmth, guidance, and possibility. Here, learning goes beyond the books. It is where future healthcare heroes are nurtured by passionate instructors who believe in their potential. From theory to practical, our healthcare assistant students gain real-world skills in a real healthcare setting, preparing to serve, support, and make a difference from day one. Because at JCK Hospital College of Health Sciences, we don't just teach healthcare. We empower excellence. Admissions are now open for our May and June intakes. Step into your future today. Find us at Blessed House, 5th floor, opposite Garden City Mall. JCK Hospital College of Health Sciences, empowering excellent healthcare.
At JCK Hospital, we understand that a child's smile is priceless. That's why our dental services are tailored with care and compassion to ensure your little ones have the best experience possible. From gentle checkups to specialized treatments, our pediatric dental experts create a safe and friendly environment, making every visit fun and stress-free. Because we believe healthy habits start young. And for the grown-ups, we've got you covered too, with top-notch dental care for the whole family. Visit JCK Hospital today, located in Roysambu, opposite Park University on Lumumba Drive, and experience dental care that's gentle, professional, and family-friendly. JCK Hospital, you first.
Difficulty in breathing is not normal, especially if you've had a number of episodes on and off. Could you be living with asthma and you are not aware? Now, according to the African Severe Asthma Project 2023, the report says 27% of people suffering from asthma cases, they are already severe cases. And this translates to the emergencies that we have, thousands of them annually. Now, May is a month designated for asthma awareness. And so we have experts here with us to cut through the hyperbole and give us insights on what is right and what is wrong. So stay tuned as we dive in. Greetings and welcome to the Healthy You. This is your favorite health program on Faith Today Television, bringing you expert health insights with hope. My name is Enock Kitondekijja, your host. Now, a special thanks goes to JCK Hospital. These are our distinguished partners. They bring to you this program. You can find them in Roysambu along Lumumba Drive, just opposite Park University. Now, today's topic is one that you cannot ignore. We are talking about asthma, when breathing gets to be a challenge. To some, it's even a battle. So the argument is it asthma or something else? Now, to help us unpack this is a group of experts we have gotten from JCK Hospital, and another one from the college who is doing a tutorship at the College of Health Sciences, that is JCK Hospital. But before I invite them to take us to the next level, I'm aware we have most of you who follow us on social media. We appreciate you, and we want to remind you again to subscribe. Now, if this conversation makes sense, remember to share it with as many people as you can, and God bless you. If you have any question, use that number on your screen. All right, back to my guests. Yes, these are ladies. Today we have ladies in the building. I'll begin with the one on the extreme. Is it left or right?
Right.
You're welcome to the show. Kindly introduce yourself.
Good morning. Thank you for having me. My name is Cardin Wanjiru Njogu. I'm a nurse and clinical educator at JCK Hospital College of Health Sciences. Glad to be here, ready for the discussion. Thank you.
Welcome, Cardin.
Thank you.
Last show we had a very exciting, interesting discussion about pneumonia, and we had questions coming in about asthma. So we want to cut through the myths and misconceptions. A lot of people were confusing asthma with pneumonia and a lot of things. But today we have Doctor again back to help us understand what asthma is really. And so allow me just let her introduce herself once again. I know because I know there are people who are joining us for the first time. Let her introduce herself fully so that we don't miss any detail. Thank you.
Praise God, everyone. My name is Dr. Joy. I work in JCK Hospital as a medical officer, and I'm pleased to be back. I love the Lord Jesus as my personal savior, and I'm very, very excited for this discussion that we're going to have about asthma. I can't wait.
Welcome, Joy.
Thank you.
And we are really glad to have you today. And for those of you who are joining us, remember this program is sponsored by JCK Hospital. Today we are talking about when breathing becomes a battle. Is it asthma or something else? Doctor, to begin with, help us set the standard for this discussion. What is asthma? We'd want to know about everything about asthma, and probably also help us understand how to differentiate it from other diseases, pneumonia, coughs, bronchitis, whatever the definition. Help us today.
Okay. So asthma is a chronic lung disease that affects the airways. So the airways are the trachea, the bronchus, the bronchioles, all those things. You know, when God created us, He created us in such a unique way. We have various parts of the respiratory system, including the nose, and then we go to the trachea, which is it's singular, and then now it branches into bronchus. And then now from the bronchus, we have bronchioles, respiratory bronchioles. There are so many things. And then eventually they end up into the alveoli where gaseous exchange occurs. Now in asthma, patients with asthma are affected in such a way that their airways are hypersensitive. Okay, they're hypersensitive to the stimuli. For example, if they are allergic to pollen, let's say pollen, if they breathe in the pollen, their respiratory system, the airways, we said the trachea and the bronchus, they will view this as a very serious thing. So they mount a very serious response to the pollen. That means they start producing a lot of mucus, and then there's constriction. That means the size reduces of the airways. So that means it's difficult for air to come in and it's difficult for air to come out, because there's constriction of the airways and there's also hypersecretion of mucus. But you know, in people who don't have asthma, when pollen gets into the body it's not such a big thing. So the response is not as bad as in asthma, as we see in asthma. So now that's why when now we have the constriction and the hypersecretion of mucus, we see patients now presenting with wheezing, they will present with chest tightness. So they feel like someone has literally sat on their chest. They're unable to breathe completely. Then you will see patients also with a cough, and it mostly happens at night because of the cold. Cold does stimulate an asthmatic attack. Yeah. So yes, cold. Coughing, especially at night. They may even start coughing when exercising, because that also may stimulate that. Patients may be allergic to perfumes, so they enter into a matatu or something like that, and someone is wearing a very strong perfume, they start having an asthma attack just because the body is hyper sensitized to the perfume. Yeah. So there are so many things, dust, mites as well. There are so many things that may stimulate an asthma attack, even infections. The minute you have a decrease in, let's say you have an infection, there's also there's an increase in the possibility of you developing an asthma attack. Especially we've seen this in older patients who have asthma. So when they come to hospital and they're having an asthma attack, the first thing we normally rule out is an infection, because that's the most common thing for them. Yeah. I think that's it. Asthma is, when I started, I said it's a chronic thing. So it's not something that starts and ends. Yeah. It's something that you will go through, you will undergo for a long time. The only thing as doctors we're able to do is just to manage your symptoms, but we can't cure it. Yeah. And it's something that happens since you're a child. Mostly we diagnose it after you have passed the mark of 1 year. So asthma cannot be diagnosed in patients who are less than 1 year. Yeah, there are many other things that will cause the difficulty in breathing in infants, but it's not asthma. So from 1 year to later on in life, you will go through it, and that's why it's called a chronic inflammation. Yeah.
Oh, I think that's a very great set-off, because you really give us a better understanding of now what asthma is. Because for our viewers, if you get to follow the discussion, she says there are triggers that you could have missed probably, and they have given you the difficulty in breathing, the wheezing. She has talked about pollen, even infections, just as simple as sniffing a perfume, a smoke, it can trigger these symptoms. And it has not been worse for you. You may think it is an ordinary thing that will wear away, but it could be really asthma. And with that background, Daktari, Cardin, I'm happy that you are here with us today. We have a challenge today. It seems to be a challenge that so many people are now having asthma in the urban areas more than the rural areas, more so in Nairobi. Why is that so?
That's a great observation. I believe, firstly, it is common in the urban areas because of how the urban settlement is. And in the urban setting, you find that there's sort of congestion. So with this, you find maybe if you have the condition already, there is the risk of the pollen and the dust and all this environmental pollution that you may find on the streets. There's waste being burned, as opposed in the rural areas where there's the comfort of the air flowing without the congestion, without the excessive congestion of people.
Yeah.
And even the matatus, let's say.
So many matatus in Nairobi, I tell you.
Yeah, so the matatus, they may be, smoke is here.
Yeah. So it's not only the noise that really disturbs us.
No.
Okay.
There's the smoke.
Yeah.
There's that inhalation, which now causes, there are those who are affected by the pollen or the dust and the smoke. So you find that the airways are now affected and getting inflamed.
Yeah.
So with this, it's not that it's not now it's up to us in the urban areas to understand what is causing this, so that we can be able to manage as expected, and early diagnosis, as Dr. had said, and this can help to reduce the numbers within the urban areas rather than, let's say, moving to the rural areas.
Yeah.
Because now almost everything we find in the urban areas.
Yeah.
So I believe with the management and observation of what exactly is affecting to cause that you're being affected by the asthma, then you have the upper hand of being able to manage the asthma.
And you put it so well, because urban areas, more so Nairobi, they say the population is over 4 million people, you know, imagine. And of course, the smoke, probably doctor help us even break down the smoke, because we see some people think is just, you know, smoking directly, like, I mean, when someone gets a puff, but we see young people today having, you know, puffing up things. I mean, break that down for us. What is smoke? I mean, how does it affect how does it predispose us to asthma?
That's a good question. So smoke does predispose us to asthma, and in that it affects your airways. Okay, so most times it will tend to, when you keep exposing your airways to smoke every day, your airways, now they say, okay, okay, now I think we need to fight this. So they become hyperstimulated.
It's a foreign body.
Yeah, it's a foreign body. They become hyperstimulated, and then now you end up with asthma. I think something that I would like to add from what Wanjiru said, we have also been seeing a lot of cases of adult onset asthma. And it's because of when they're working in the industries with machines, they emit a lot of chemicals, okay? So these chemicals tend to affect your airways and they will lead to asthma. In Nairobi especially, I've seen a couple of adult onset asthma in patients who are working in these big industries, working with very heavy machines. They're not wearing protective gear, the masks that we normally see them wearing, then they are predisposed to asthma.
Wow. Thank you so much. The ladies give us great information about asthma. Those of you who are just joining us, remember, this is brought to you by JCK Hospital. And in case you have any question concerning this particular dialogue we're having, feel free to send it in right now using that number on your screen. And remember, the earlier you do, the better. Dr. You talk about picking asthma in the adulthood. I mean, it's been a challenge. I mean, diagnosis today is a concern because some are misdiagnosed, some are underdiagnosed. So we are wondering, is it because the health workers we have today are rather incompetent, or we don't have the necessary equipment to perhaps, I mean, diagnose this? Why is there so much undiagnosis and misdiagnosis in practice?
Okay, that's a really good question. So for asthma, there is no specific diagnostic test that we can do to diagnose it. So how we diagnose it is via the symptoms we see. So if you notice a child or a patient is coughing a lot at night during exercises, they're wheezing, they're having chest tightness, you notice that they're having shortness of breath, all those things, the symptoms are the first step in diagnosing asthma. Then for the tests, there is no specific test. Like when you do a chest x-ray, it's normally normal in asthma patients, you see. So there's no specific test in diagnosing, but we normally do a test called spirometry. A spirometry is where you ask a patient to take a deep breath in, okay, then to take a deep breath out in a device we call a spirometer. So they take a deep breath out in 1 second. So in that 1 second, there are lung volumes. You know, lungs, our lung has a lot of air. So those airs, the air, we measure them in volume. Okay, so the volumes are what we are checking in the spirometry. Okay, so now when they're expiring the air, in that 1 second, we're checking a volume called FEV. We call it first expiratory volume. Yeah. So that normally in asthma patients, it's normally reduced. Yeah. And then, but you see, it's reduced in asthma patients, but it can also be reduced in other conditions like COPD. That's why I'm saying there's no specific diagnosis for asthma, you see. So now, in that same test, the spirometry test, we do a bronchodilator reversibility test. So here, we administer a bronchodilator, which is, I'll show you just now. It's an inhaler that causes your airways to dilate. So when we give that, and then we repeat the spirometry test, if you notice that the forced expiratory volume has increased, you see it has been improved by giving the bronchodilator. So now that is when we can diagnose this patient as having asthma. Yeah, but most hospitals, I don't think they do the spirometry. That's why it becomes very hard and difficult to diagnose it. And then so the diagnosis most times is normally delayed, especially in adult onset asthma. Before us doctors are able to get into that diagnosis, most times we tend to confuse it to pneumonia, or we confuse it to bronchitis or COPD. Yeah, so yeah, it is normally a bit difficult to diagnose.
It's a challenge to you guys.
But in children, diagnosis is not that hard.
Okay.
Yeah.
I mean, also, I mean, speaking of, it's not hard in children, because when you look at it, most people actually, for example, the adult onset asthma, I mean, the myth is, or maybe what people think, is that asthma does not need treatment. If you have it during childhood, it will wear away as you grow. What do you have to say about that?
Oh no, we do. Patients really need treatment for asthma, because now, yes, you may ignore it for a while, but there is a time where it becomes really bad, and most times it may lead to even death.
Even death?
Yes.
Oh, speaking of death, for our viewers, in case you're not sure about whatever we're discussing today, you are not sure it is asthma, you are not sure it is another respiratory disease, send in your question right now. We have experts in the building to help you answer, and also get to help you breathe better in case you are facing challenges with difficulty in breathing. Cardin, we have you on the show, and we want to know, what do you take of all this? I mean, what comes to mind when you talk about challenges with diagnosis? I mean, what comes to mind?
The first thing that comes to mind is, so far we have to understand what is done for the assessments and for the early diagnosis. So once you observe these signs and symptoms, it is important that you just don't throw it back and say, or go over the counter drugs. It is of importance that you take the next step to at least find the nearest hospital, or a hospital where you can be done for the right diagnosis, so that we cannot have, again, the challenge of you're being treated for the wrong thing. And as we know, one problem, you can be hiding a problem on top of another problem. So we may be having to deal with asthma, which was maybe something we could hold and manage for a while, but as you're adding other things, it becomes worse. You have other diseases developing. So it is of importance, as Dr. say,
early diagnosis. And I agree with you, because when you look at it here in Kenya, as in ASAP report says that most of the cases, in Nairobi, asthma cases are severe cases, and they are resulting to emergencies, meaning people really take time, not sure. And I believe that's why we have you guys to help us understand that. I know we're going to take a short break, but before we do, Doctor, help us really understand now the difference. How do you differentiate between asthma and, let's say, pneumonia? Are there cardinal symptoms or maybe signs that we need to look out for so that we are not in the dark?
Yes, okay. So, as I said, pneumonia, asthma is a chronic disease. So that means you cannot treat it. As opposed to pneumonia, which can be an acute illness where you can treat it and it goes away. That's one difference between pneumonia and asthma, and even other diseases, other respiratory conditions. The other one,
you talked about COPD something.
Oh yeah, COPD is chronic obstructive pulmonary disease. So it has two diseases in that whole bracket: emphysema and chronic bronchitis. So emphysema occurs mostly in patients who smoke, in the smokers, where your lungs, they become very loose. So they're not your alveoli. The alveoli are where the gaseous exchange occur. So they become very loose. They're not able to contract, release. They just are there. And it becomes very difficult for them to breathe as well. Now that is in emphysema, and it happens in smokers. For chronic bronchitis, it doesn't necessarily happen in smokers, but you will see the patient develop cough, very chronic cough, 3 months, and it happens regularly. Okay, so in 3 months, you will notice that they're coughing for those 3 months, and then it ends, it stops, and then again it comes back, the cough again, and it's not able to be relieved by any medication. Yeah, so there are differences between COPD and asthma, especially when you do the spirometry test. You'll be able to see the differences between the COPD and the asthma. When I said the spirometry test, I talked about the bronchodilator reversibility. When you do that, in asthma it helps, but in COPD it doesn't help. And then also COPD mostly happens in adults. Asthma we see it mostly in children. And then also the symptoms. The asthma, you'll see the wheezing. Pneumonia may have wheezing, but it's not a very common symptom in pneumonia. Wheezing is a very common symptom in asthma. The chest tightness is common in asthma, not very common in pneumonia, but the rest of the symptoms are common. So yes, it is hard to diagnose, but then when you do a chest X-ray pneumonia, as we said last time, you will see signs.
Yeah.
But in asthma, it's not. Yeah.
Well, for our viewers, you can tell that this is not something that you can just jump over. If it is giving a challenge to the doctors themselves, I mean, you cannot just stay longer without getting the answers. So it's important that you do not lag home, get to know what you are really suffering from, and they're well placed to help you pick the clinicals and everything you need to know about asthma. Yes, I mean, Dr. Ali, and we are really grateful for the information you're giving us. Maybe before we take that break, walk us through, just to give a glimpse of what we are going to have in our second segment about the treatment. Is there any hope of someone getting better? I mean, just highlight for us the treatment plan, the management plan. Can even asthma be managed?
Oh yes, asthma can be managed. And I've carried with me some inhalers I'm going to show you, and how to use the inhalers as well. But inhalers are what we use for managing asthma. And okay, we can also give drugs in severe cases, but inhalers are what we use for the minor and mild cases. And then also, just for the adult onset, if you're working in areas where there's a lot of fumes, there's a lot of gases, you need to wear masks as your protective measure. Don't be what will I call it? Do not fail to wear those things. Don't take it as an ordinary thing. No, it's very important for you to wear masks. And also, just for the children, if you identify the specific allergen that they're allergic to, if it's pollen, make sure that they avoid pollen. If it's perfumes, make sure that you're not using a lot of perfumes.
Before you say the third one, I know it's very important. I want our viewers to get it in the second segment. And she has talked about something very important. She has highlighted inhalers. I mean, I'm also confused. What is an inhaler? How does it help me in asthma? That is some of the points that you really need clarity on. And I mean, I want us to break this down in the second segment. Of course, we're just going to take a few minutes. And when you return, we're not talking about prevention. We are talking about management. We're answering your questions. I hope you send in your question so that we can have a full-blown discussion that has no doubt. I mean, we're going to take a short break. Don't miss this. Share the link with as many people as you can. God bless you.
Every great journey begins with a single step. And at JCK Hospital College of Health Sciences, that step is met with warmth, guidance, and possibility. Here, learning goes beyond the books. It is where future healthcare heroes are nurtured by passionate instructors who believe in their potential. From theory to practical, our healthcare assistant students gain real-world skills in a real healthcare setting, preparing to serve, support, and make a difference from day one. Because at JCK Hospital College of Health Sciences, we don't just teach healthcare. We empower excellence. Admissions are now open for our May and June intakes. Step into your future today. Find us at Blessed House, 5th floor, opposite Garden City Mall. JCK Hospital College of Health Sciences, empowering excellent healthcare.
Faith Today TV is here to make your brand outstanding. Worry not on where to advertise your business or your product. Call us on 0114 777 000 or email us on info@faithtodaytv.co.ke.
Hello there, my name is Enock. Taking care of your health should be a top priority. Looking at the various engagements that we have today, it is so easy to forget about our health, mental well-being. That is why we introduce to you the Healthy You Talk Show, a brand new show that is going to address matters concerning your health, nutrition, stress management, mental health, name it. We bring to you a wide range of experts who are going to be touching pertinent issues concerning our health. Tune in every Tuesday at 10 a.m. live on Faith Today TV. All right, welcome back once again to our discussion. We are talking about asthma. Are you battling to breathe? Are you confusing asthma with some condition that you are even not sure about? We have experts in the building helping us identify what asthma is and how we can manage it. So in our second part of discussion, we are going to be focusing on management. The experts highlighted a protocol, a plan that you can follow. They are going to be taking us through that. And then we're also going to be answering all your questions. I hope you sent in your question. I hope you let us know where you are watching from. Very, very important. Before we took a break, Dr. Joe, you are helping us understand the way you manage asthma, and you are giving us a bit of hope that it can be managed. How so?
I think I gave the preventative measures where I said you should avoid the allergens, those things that you know may raise an asthma attack. Just avoid them to prevent you getting an asthma attack. For the people who work in industries, you wear protective masks, and also when you know that you have asthma and you have an infection, make sure you visit your doctor to treat the infection, because as we said, an infection may stimulate may cause an asthma attack. So when you have an infection, just make sure you go to the hospital so that they're able to treat the infection to prevent the asthma exacerbation. Now for the treatment, we give inhalers. So we have different types of inhalers. We said that there's a drug called a bronchodilator that enlarges your airways. And then there's another one where we give a steroid as the inhaler to help reduce the production of the mucus. Okay, so now I brought one with me. This is a steroid. It's called Budecort. It's budesonide. It's a budesonide inhaler. So now many patients I know will be given this one. I don't know if you'll be able to see, but there's a place here that is talking about the dosage. This is the dosage. This one, yeah, this one.
So meaning you don't just use these things?
Oh no.
Okay.
There's a dosage
We
give particular dosage. So there's a low dose, there's a medium dose, and then there's a high dose. It depends on how many attacks you've been having. Okay. So asthma management and medication is normally stepwise. So if, for example, you have been having just 2 attacks, less than 2 attacks in 1 month, then there's no need of giving you an inhaler to use every single day. Yeah. So you're given the other one, the bronchodilator, to use when needed, when you have the asthma attack. Now, if your asthma attacks start increasing, then now you need to go to hospital so that the doctor is able to change the dosage for you. Now you will be needed to use an inhaler every day, okay, to prevent the attacks. Especially if you're noticing that the asthma attacks are more than 2 in 1 month, or every time you walk you have an asthma attack, or every time you're exercising you have an asthma attack, you really need to go and see a doctor so that they are able to change the dosages for you. I'll show you in just a bit how to use the inhaler, but yeah, that's the basic thing. We just give inhalers. But then now if you're noticing a patient has really, really bad asthma attacks to the point that they last for so long, and then when you give the bronchodilator, it's still not alleviating the symptoms, then a doctor may prescribe oral medications, oral steroids, just to help. So you'll use the bronchodilator, you'll use even this one, both inhalers, and then they may also need to add an oral medication just to help with the symptoms, but that's basically it.
And I think that's very elaborate, must admit. Inhalers, for those of you who are just joining us, look to be the gold standard here, and they help a lot. Cardin, when you hear all this, I know we have so many people who are following us from different parts of the country, and there are those who really can't afford this. I'm sure someone has to pay for this, right?
Yes.
Yeah, and the range is from 500 to 1,000. I mean, Cardin, you train nurses on how to identify some of these symptoms, or how to help people, deal with asthma. But in case someone can't afford this, how are you trained to train these nurses to help?
Okay, so that's a valid reason, because it's not everyone who can actually afford the 500 to 1,000 bob just when you have been diagnosed that now you need the inhaler. So as a nurse, I am not just there to be a caregiver, and this I have to transfer to the students who I am teaching also. I am also an advocate for the patient. So how we do it is, as a nurse, I'll be expected to advocate for this patient. How can I advocate for this patient? One, maybe discuss with the clinician or the doctor. Is there maybe something else, or how they can manage to get the same relevant dosage? And also, could there be a link to support groups? Or also, in this time we have NGOs, we have government subsidies. You find that the healthcare system, there are different levels of the healthcare facility system. So maybe at the lowest level, there are the community health workers who educate and are able to monitor for the to actually know on these symptoms early detection. So with I being a nurse, I can link this patient to maybe an NGO if I have the link, or also government subsidies. And as well, maybe as we are training the students here at JCK College, we are able to tell them, okay, you need to talk on behalf of this patient. Is there an other option? If there is not, then what is the next step? In every facility, I believe there's the social status of the social side of the hospital, where they look at the capabilities of these patients. Yeah. If it's not possible, then we are able to now find a solution. Is it medication that is a bit cheaper?
Yeah.
Is it any other option? Daktari, I believe we can, with the inhalers and the medication, we can get a balance in between, where we factor all these patients without
and
spending.
I think that's very important, Cardin, because when you look at it, we need more advocates, even in the health sector, to help give options to doctor. You agree with us, not everyone can afford this medication. I don't know if you have any options. Nurses are helping us explore all this. I don't know what you have to say about that.
I think I've been seeing WHO really be involved in the asthma treatment, and I've been noticing them even offering them for free for those patients who are not able to afford them. And there are also very many NGOs that have been trying to lower the prices of the inhalers, which is very good. I wouldn't say that there's a specific alternative to using the inhaler, but preventative measures work really well, especially if you're able to identify the specific thing that is causing the asthma attack and you're able to avoid it, then the use of the inhaler also reduces. So you tend to not need it as much. And then also when you are very, very serious about managing your asthma, as you grow and as you develop, the body tends to heal itself by its own. So I'm not saying that it will end, but I'm saying the management of it becomes very easy for you, especially if you take very good care of yourself when you're young. When you're a child, you're using the inhaler well, you're following what the doctor is saying. As you're growing up, your body tends to get used to the allergen. It tends to have less of the asthma attacks. So the lesser you will need the inhaler. So most times I've been saying, for the adults who used to have very bad asthma when they were children, when they're adults, they just keep it in their pockets, but they don't tend to use it because their body worked very well to just heal itself eventually. And but I'm not saying it will end. I'm not saying that.
I know, and you give me so much hope when you tell me this thing is manageable, and when you go through the various options available, it helps me understand now for the viewers that when you hear what all the experts are saying, is that it can be expensive but very helpful. But in case you can't afford it, they're helping us understand that if you can identify the triggers, a bit earlier, that's why people get better as they grow old. I mean, when you're able to understand the triggers like they have talked to us about in our first segment, you're able to manage this and you don't have to have this at all times. But with that said, Daktari, still we have people who believe that these things are harmful, they are addictive. I want you to address that today, so that I mean, some people even prefer herbals than anything else. They will even go for the orals. Help us understand that. Why this?
Oh, okay. So, I would not say that they're addictive. They're not addictive.
That's what people believe.
But I've never heard that before, but it's okay. They're not addictive. They're just, they're restrained to when you're breathing it in, they're just in the air spaces. They're restrained there. So they don't go to the rest of the body. You see, it's very hard for you to get addicted to an inhaler. And then also, when you take it when you're okay, when you're fine, it may become very painful. So not unless you're having an asthma attack. It's normally very painful to use it. So it's not addictive, it's not. And I think it's very safe for you to use. Just as I've said, okay, yes, every medication has its own side effects. True, that's very true. But it's when you use it for a long time. I've said if you keep taking care of yourself, you keep avoiding the allergens, you make sure that you're taking them well, eventually your need for them will just stop. Okay, it will just reduce. So okay, yes, it does has a side effects. And if it does affect you in a way, please make sure you go to the hospital and address it with your doctor. But if it doesn't, I think I've seen it work and I've seen it be very good for the patients.
It's life-saving. Thank you so much. We are enjoying the discussion. Myself, I'm learning a lot today. I mean, having a belief that these things are addictive and then getting to hear that they're really not addictive, but rather saving your lives. I think that's very important, because, I mean, when some people feel like whatever you're puffing, it's addictive, that's when it's healthy. That is very, very helpful. For our viewers, I want to appreciate you for joining us and tuning in. For those of you who are sending in questions, again, I request you do that with your name and where you are watching from, so that we're able to serve you even better. I see so many questions coming in. Someone is asking, good morning, can asthma develop in adults, or is it only a childhood condition? Did we answer that?
Yes, I did.
Okay,
yes.
We answered that, right. Someone asked, are wheezing and coughing always signs of asthma? That is Josephine. Josephine is asking, Daktari, wheezing and coughing always signs of asthma?
Oh, no. We said wheezing can also be seen in pneumonia.
Yeah.
Coughing can also be seen in pneumonia.
Okay.
So you just present yourself to the hospital so that we're able to distinguish the two.
Okay.
But in patients who are known asthmatics, when they have wheezing and you cough, that's definitely asthma. Yeah?
Okay.
Yeah.
All right. We have another one. Anne is asking, hello, what are some unusual triggers for asthma attacks that people might not be aware of? I think now you need to list all of them today, because people want to live healthy.
Okay.
Yeah.
Pollen. I said pollen, dust.
Pollen. What is pollen?
Pollen is
in Kikuyu or what? In Uganda.
Pollen is what flowers produce when they are blooming.
Okay.
Yeah.
Good.
So during the blooming season, we see a lot of patients come to us with asthma attacks.
Yeah.
So pollen is one, dust is another. Cold season. I said that when, especially at night, patients tend to have a lot of asthma attacks, and it's just because of the cold.
Yeah.
Perfumes, very strong fragrances also may stimulate an asthma attack.
Yeah.
Infections, especially of the respiratory system. So a common cold, as simple as a common cold, may lead to an asthma attack. When you have, especially in patients who have exercise intolerance asthma, The ones who just, when they just do a bit of exercises, they get an asthma attack. It can be a stimulant for an asthma attack. And maybe other things.
Okay. I mean, Cardin, has she left out any? I want you to give us everything.
To add on, I can also add animal dander for some. Yeah. We'll also have the air pollution.
Yeah.
But basically, she had covered most of it.
Okay. So, and you get that answered. Those are the triggers when you identify any of them, and you get these dramatic, difficulty in breathing, wheezing, and whatever they have talked about. That could be a sign. And so it's important that you visit the nearby healthy facility. The closest we have right now is MBChB Hospital. And then we have Fidelis. Fidelis says, I am Fidelis in Githurai 44. How effective are inhalers, and are they the only treatment for asthma?
Okay. I think I also mentioned this. Inhalers are very effective in managing the symptoms of asthma. And as I said, asthma is a very stepwise mode of we treat it stepwisely.
Yeah.
So it just depends on the symptoms that you have.
Yeah.
Now, in the severe forms, that's when we will need to add oral medication to supplement the inhalers that we are giving you. Yeah. So yes, it's a stepwise thing. Inhalers are very important.
Okay. Do you agree?
Yeah, I do agree.
Awesome. We have Esther in Lumumba Drive. Esther says, can allergies alone cause breathing issues similar to asthma?
That's a very good question. No, I would say no. They wouldn't cause difficulty in breathing the same as asthma. Yeah? Yes, that's what I'd say.
Okay, and of course there are so many allergens.
Yes.
All right. We have so many questions coming in, and we want to appreciate you. But again, if you are sending in a question, simply we want to recognize you and also appreciate where you're sending from. Your name and your location is very important. Are there specific activities or sports that children with asthma should avoid?
Oh, no. No.
Even swimming?
Please do not refrain your child from
Even swimming?
participating in sports.
Even swimming?
The more they are participating in sports, the more their respiratory system is adapting to them having asthma. You see, please do not restrain them from playing outside with their friends, going for volleyball. Even I've seen athletes who have asthma.
Really?
Yes, I've seen athletes who have asthma still are able to run outside and go for marathons. So I would advise, don't restrain your child from asthma. Just that when they're having an asthma attack due to exercise, make sure you are walking with a doctor, okay? So that he's able to tell you, okay, maybe you can reduce on that exercise with you can reduce the exercise for the child. You can work with them and then they tell you, oh, yes, they can participate in it, but to this extent, let them avoid it. With time, I personally think that exercising will help that child's respiratory system grow and even overcome the asthma.
The asthma. Wow. Do nurses agree with that? Do you really?
Yes, I do agree with that, because once you restrict this child, you are bringing them into the cocoon that they are sick and they can't do what others are doing. So it is of importance that if this child is going to participate in this activity, maybe inform the teacher or the person who is going to take them through. Maybe this child has a diagnosis of asthma, and this is the presenting symptom that may be present. I know the attack may develop suddenly, but once they are informed, the teacher or the person taking them through is informed that there is this risk, they have the knowledge. They can have the knowledge of how to manage before the symptoms worsen. But you can't hold the child forever saying, you can't do this, you can't do that. They have to grow, and it is at that point that you have the capability of holding. But the moment they're out of your circle, it may be difficult. So it is of importance to encourage them.
Okay.
Yeah.
I know we are going to be rounding up this very soon. You know, we cannot have it all. But I mean, as we conclude, Daktari, help us understand, what does an active full life mean for someone who has been diagnosed with asthma?
That's a good question. I think an active full life means they can be very normal. They are just normal human beings. It's just that when they're exposed to a specific allergen, that's when they react. So for them, I think what they would need to do is just to avoid the allergen, and then everything else will be normal for them. Just make sure you have a specific doctor you're working with, and I'd really advocate for Jessica Hospital, because our doctors are very well equipped and they're very welcoming and ready to help you. Just work with your doctor so that they are able to prescribe the right medication for you. Because if you have the right medication, then your life will be very easy and simple, and you're able to live even a very prosperous and long life. Yeah, that's what I'd say.
Prosperous and long life. Prosperous is more of charismatic, but I mean, it's okay. This is Faith Today Television. As we conclude, you talked about Jessica Hospital.
Yeah.
What specific thing are you doing this month? I mean, is there any offer you have for us? I think that's very important for our viewers, more so those who follow us ardently.
Yes, we have an offer for our ladies. So we have a reduced charge for all the ladies who would like to come and see a gynecologist. You're very much welcome to our hospital. The charges have been reduced to 1,500 from 15th. It started yesterday, 15th, all the way to June 14th. You're very much welcome. Yeah, we will be happy and ready to serve each and every one of you.
Asante sana. Is that pregnancy fair as well?
Yes.
When is it?
All gynecologists, things, and also obstetric conditions, all are welcome.
Wow. These people are helping us identify conditions before they really manifest, and that is very important. Cardin, I mean, we are wrapping up. If you mind, looking at the camera, giving us your closing remarks, and also helping us understand how faith can complement management of asthma. Your view?
No, okay. So I believe that faith and family work together. Both of them empower each other. So in the management, when you now bring in both of them with the family and the knowledge and the ability to empower the person who has been diagnosed, we are able to bring this person into the understanding that they may have the condition, but together they can manage and help this person move from one in their life in each and every other day.
Yeah.
So yeah, that's we should not ignore that now that you have a chronic illness, it is time to die or anything. Yeah. So with the faith and believing that all things are possible, you grow, the child can grow, and you as an adult can be managed well with asthma or any other. Yeah.
All right. And thank you so much for that. Are you doing anything at Jessica College?
Yeah, so at the hospital college, currently we're having the May-June intake. At the moment, we're training healthcare support service providers. These are also known as healthcare assistants or certified nursing assistants. We are TVET accredited, and we have the pleasure of being under Jessica Hospital. Therefore, why choose us? Obviously, because we have the internship slots ready for you. So it's a 6-month course, just a very short time, 4 months in classwork and 2 months in hospital. So you have the advantage of direct coaching from the hospital. So join us this May, and as the classes begin, you're very much welcomed to enroll. For more information, you can check on the hospital website also, and as well call the number that will be shared. Thank you.
Thank you so much. And of course, the number must be running through the screens. We are so grateful for your expertise today. Thank you so much, Dr. Joy and Cardin. That has been really insightful discussion. We are so grateful. And for our viewers, we want to thank you also for tuning in, for working with us. I know there are those who are watching us from hospital, from home, and you are probably struggling with breathing, you are struggling with asthma. The hope is that with early diagnosis, the right kind of care, asthma is manageable. It can be really managed very well. And along with faith, it's important to believe God, because we believe that as much as doctors are treating whatever they are doing, God has given them the mind, God has given them the wisdom, and so we believe God for your healing. Thank you so much. My name is Enock Kitondekijja, and this has been The Healthy You. Until we meet next time, stay proactive, stay informed, and stay prayerful. God bless you.
At JCK Hospital, we understand that a child's smile is priceless. That's why our dental services are tailored with care and compassion to ensure your little ones have the best experience possible. From gentle checkups to specialized treatments, our pediatric dental experts create a safe and friendly environment, making every visit fun and stress-free. Because we believe healthy habits start young. And for the grown-ups, we've got you covered too, with top-notch dental care for the whole family. Visit JCK Hospital today, located in Roysambu, opposite Park University on Lumumba Drive, and experience dental care that's gentle, professional, and family-friendly. JCK Hospital, you first.